Hello and welcome back. Dr. Cam here. Today we're going to be going in on something very important. I take care of a lot of vertigo, a lot of dizziness inside of this clinic, and I want to be able to create a tier list for those who are looking at exploring different options to be able to see which ones should we start with and which ones should be the last resort, because unfortunately this type of information is not available to the public in a way that is feasible. And so what I would like to do is create a video to help kind of navigate that. For those of you that don't know, my name is Dr. Cameron Daniels. I am one of the clinic directors here at the Specific Chiropractic Centers here in Little Rock, Arkansas. We specialize in multiple different conditions, but the most common ones that we see are migraines, fibromyalgia, autoimmune conditions, CRPS, vertigo, and dizziness. Essentially all those conditions where people feel like they've tried everything, they've been everywhere, and it seems like nothing is even touching it. And the reason why is because it could be stemming from a central nervous system issue. So for those of you that are interested, please feel free to explore our website. We have a ton of free resources on there. We have an app. All of this type of stuff can be very useful for you inside of your journey. With that being said, let's go ahead and get started. So you'll see on this list here, I have S, A, B, C, D, or S, A, B, C, and D. Okay, S is going to be most effective, A, highly effective, B, moderately effective, C, minor benefit, and D is going to be a last resort. I want to make something very clear here. Everything that I'll be talking about in this video is looking at long-term solutions for vertigo and dizziness. There's a lot of great things that are very beneficial for short term, but here's the reality, is when things are short term, it's not actually fixing the root cause of the issue. Stuff that will be going on in this, or stuff that we'll be going in on in this video is going to be able to reveal to you exactly what's going to help long term. Let's go ahead and get started. First off, we have vestibular rehab and balance therapy. This is typically done with a physical therapist. This is not the Epley maneuver. We'll talk about that later. But vestibular rehab, what they're looking to do is to train the vestibular centers inside of your body to be able to withstand the physical stressors that someone is going through on a day-to-day basis, hence the balance therapy as well. This is typically done with a physical therapist, like I just said, and there's typically some form of treatment plan or some engagement on the patient's part to be able to get the long-term sustainable relief, meaning that you'll be going to them maybe one time a week, maybe 2 times a week in the beginning, and you'll slowly be tapering yourself off, which is what I can appreciate and respect. So with this being said, vestibular rehab, I'm going to put this in highly effective. And the reason why I'm not putting this in S tier is because vestibular rehab is looking at one component of it, which is the physical component of it, but there's multiple different components that can actually be impacting vertigo, which we will talk about later. Next up, surgery and injections. Now, these are very, very rare, but sometimes what can happen is people can have surgery on the inner ear that can help displace some of the symptoms that people are experiencing with vertigo. This is very, very dangerous, and this should be a last resort. So I'm going to put that into a D tier. If someone is experiencing vertigo, let's say it's your first bout, or let's say you've even been dealing with this for 5 years, okay? Surgery and injections should be the absolute last resort after you try literally everything on this list. This should not be the first line of defense. If this is the only option that your doctor is giving you, I would recommend either switching providers or letting them know, showing them this video maybe, and letting them know that there's other options out there before someone starts doing surgery on your ear. So next up, move carefully and avoid sudden movements. A lot of times when people come to see me with vertigo, this seems like it's a very viable solution. And here's the reality. I mean, vertigo is distorting, right? Dizziness is distorting, means that it changes your entire perception, your entire worldview to where you're actually unable to function. But here's a problem about moving carefully and avoiding sudden movements. We cannot live our entire life like this. We cannot. And so this is going to be very good to stop the sudden onset of symptoms when they come on. But long term, we want to look at solutions that can actually get rid of the issue and not just put a Band-Aid on it. So for that, I'm going to put this in the C tier. It's going to be a minor benefit, and only because it's not sustainable long term. Most of the people that come in here, they're in their 30s, anywhere between 30s and 50s. And we have a lot of life left, God willing, but we have a lot of life left on the on that patient. And so just moving carefully and avoiding sudden movements just not realistic long term. And it actually can cause other issues down the line, such as anxiety and depression, because we're isolated, because we can't do much. So I'm going to put that in the C tier. General chiropractic. For those of you that don't know, there's two different types of chiropractic. There's a general chiropractic, and then there could be a specialty of chiropractic. So, for example, I'm a specialty chiropractor. My subspecialty is in neurology. And so because of that, I have extracurricular training that makes me specialize in that particular area. General chiropractic is going to be, you come in, you get adjusted, you leave, and, you see them the rest of your life. Doesn't always have to be the case. Again, I'm being very general here. General chiropractic can also be your family chiropractor, right? A lot of times when you look up chiropractor near me, that's a general chiropractor. That's going to be someone that just opened up shop. They see good results. They're looking for overall health and wellness, but are not targeted towards specific conditions. So for general chiropractic, because they may be adjusting the neck, although sometimes they're adjusting the neck in two directions, that's a whole different conversation. General chiropractic, I'm going to put in the B tier, moderately effective. The reason why is, again, because it's not specific towards the individual. It's just general spine health. And again, if you're looking up chiropractor near me, most of those chiropractors on that list are going to be the general chiropractors. So for that, that's going to be in B tier. Epley maneuver and BPPV repositioning. So this is the gold standard, and I want to make this very clear. Epley maneuver is the gold standard for dizziness and vertigo. Oftentimes, it only has to be done once or twice, and people get instant relief. And if that's the case, that means that positioning was able to reposition those crystals inside of the inner ear, and it gets the patient to be able to really not experience another vertigo symptom again. And if they do, and they do the Epley maneuver again and it goes away, this can be a very, very beneficial thing. I don't really see, it's minorly invasive. You're literally just moving the head in a very specific way. This can be done with a specialized chiropractor, or most oftentimes with a physical therapist. They will do this before they start doing vestibular rehab and balance therapy. I'm going to put Epley maneuver in the S tier. And the reason why I'm putting in the S tier is, again, it's because it's highly effective. Now, for those of you, again, long-term here, for those of you that have had the Epley maneuver and it's gone away, glory to God for that. That's awesome. That's awesome. That means that that's a very beneficial thing for your body. It means that it's more of a crystal type issue. It's just repositioning. But for some people, even if it's not effective for you, it's not the Epley's fault, okay? And it's not your fault either. It's just a different type of vertigo and dizziness that we're looking at. But for long-term use, minimal invasiveness, Epley maneuver, especially done by someone who's qualified, a qualified chiropractor or a physical therapist, Epley maneuver is absolutely incredible. So that's going to be in S tier. Sleep hygiene. I can't tell you how many times I'm having conversations with my patients about sleep. Sleep is the most critical thing that someone can experience, period. We spend a third of our lives, realistically. We should be spending a third of our lives sleeping, truly. And a lot of times if someone has bad sleep hygiene, it's because we don't have a wind down routine, or even worse, we don't have a morning routine. And if we don't have these things in place long term, it can cause major neurological dysfunction. And so I'm going to put sleep hygiene, I'm between S tier or A tier. I'm going to put sleep hygiene in the S tier, okay? Again, it's an S tier because it's most effective, because if it's neurological, complementing with other things that you could be doing. If it's neurological, sleep hygiene, having a proper wind down routine, having a proper wake up routine, and then getting adequate amount of deep sleep, which you can track on an Apple Watch or a Fitbit. Getting an adequate amount of deep sleep and a REM sleep will heal your nervous system, and in healing your nervous system, we will experience a lack of dizziness and vertigo. So the problem, though, with sleep hygiene is that people don't get enough of it. And again, if you're not getting enough of it and you're having dizziness and vertigo, this is easily the first place that we can start. Just having a consistent routine, and over time we should start to see those symptoms start to go down. But a lot of times, again, it's just patient compliance for sleep hygiene. And plus, those who are experiencing dizziness and vertigo, most of the time when they're laying down, that's when it gets better. So having proper sleep, you're giving your nervous system a break because it's trying to recalibrate itself throughout the day, and you're getting proper sleep. I mean, it's just there's no cost, there's nothing wrong with getting better sleep. Upper cervical chiropractic. Upper cervical chiropractic is also upper neck chiropractic. This is a subspecialty of chiropractic. This is actually the one that I specialize in. Upper cervical chiropractic focuses on the upper two bones in the neck and restoring neurological integrity, because what can happen is the brain can send abnormal signals to the body, and the body can send abnormal signals to the brain. Or even worse, which is what we see in vertigo, there's a feedback loop that's trying to close itself, and if there's an inability to close that feedback loop, the brain can start to send chaotic signals to other areas of the brain. In this case, it'd be the cerebellum, and this is where we can see, vertigo and dizziness, and even balance issues as well. The brainstem controls every single cell, tissue, and organ inside your entire body, and it sits right behind your ear. Okay, it's actually these two bones right here. I'll show you in the camera. These two bones, one's called the atlas and one's called the axis, and in between this little slot right here sits the brainstem. In your brainstem, if there is any form of friction happening on the brainstem, the body can send abnormal signals, and those abnormal signals can produce these things called symptoms, one of those symptoms being vertigo. So what the entire goal of care is with upper cervical chiropractic is to get to the root cause of what's causing this. Upper cervical chiropractic is very targeted, it's very specific, it's very tailored towards not just the symptom, but towards the individual. Because what we like to do is we don't like to say that this is your dizziness. We understand that dizziness and vertigo is just a bigger issue of a neurological problem, right? The vertigo is just the fire alarm that's going off inside of this home called your body. And what we have to do is not just take the batteries out of the fire alarm, but actually go in there, put out the fire, and then rebuild this beautiful house called your body and your central nervous system. But this being said, and there may be some bias here, sure, but I just see very, very good clinical results with this. Upper cervical chiropractic is going to be in the S tier, mainly because we're correcting the root cause and we're trying to look at other external factors, physical, chemical, and emotional stress that's placed on the system that could be causing more dizziness and vertigo down the line. So our entire goal is to not just stop the vertigo, but also to make sure that we're in a place where the body's able to continue excelling well beyond even care here. It's very structured towards the individual. It's not just a shotgun approach. There's 1 out of 276 different ways that these bones can misalign. Our training is in the one. Upper cervical chiropractic is in, that's in S tier. I'm not going to keep going on about that. If you guys have any questions about it, please let me know. Upper cervical chiropractic is in the S tier, but this is important for those of you that are like, I have vertigo. This is interesting. I want to look up upper cervical chiropractor near me. There are people that market themselves as upper cervical chiropractors who do not practice this work exclusively. That's where you got to be careful. That is where you have to be careful. So there's different questions that you can ask. If you want those questions, feel free to comment. There's questions you want to ask an upper cervical doctor to make sure that they're practicing exclusively upper cervical. If they're not, they're just practicing general chiropractic under a false subspecialty. So next, stress management, relaxation, and prayer. Research time and time again understands and shows that when someone is able to manage stress, not just dizziness and vertigo go away, but a lot of different types of symptoms go away. Stress management is key. I mean, I would put it up there with sleep. I think it's not as important as sleep, but stress management is identifying different things in your life that actually help reduce stress. I want to make this very clear. Sometimes it's your family that's causing you a lot of stress, and you have to make a very, very critical decision. Sometimes it's your work that's causing your migraines or your vertigo, and we have to make a very, very critical decision. Like, is it worth, call it what it is it worth slaving for someone else to experience migraines the rest of your life or dizziness the rest of your life? If you notice that stress increases your symptoms, I'm going to put it in A tier. This is a very highly effective thing that we need to look at. I'm not going to put it in S tier because sometimes it takes radical life change that some people just are not willing to do. And for good reason, everyone has their reasons, but stress management, relaxation, and prayer, we're going to put this in the A tier. Gentle exercise, Tai Chi, and yoga. Again, this is shown to be able to decrease dizziness and vertigo. I'm going to put this in minor benefit. And the reason why I'm putting it in minor benefit is because, again, if someone is unable to do these things, then we don't want to start implementing these things. We want to get to the root cause, especially before we start doing any form of motion like exercise, Tai Chi, or yoga. So I'm going to go ahead and put that in the C tier. Not that this stuff is not beneficial. It's very, very beneficial. But for those who are suffering from vertigo and dizziness, that you can't even see yourself doing a child's pose without potentially falling over. So again, we're looking at long term here. Medications. So medications sometimes, I'm just gonna put this here. Medications are going to go into D tier. And the reason why medications are going into D tier as a last resort is, again, because a lot of these medications that doctors are prescribing, not that they're not beneficial, but they do not correct the root cause. They're just masking the issue. This is just taking the battery out of the fire alarm, but the fire is still getting bigger. Medications has saved lives. Medication has made it to where someone was able, to actually go grocery shopping for the first time. But again, these are just masking the actual issue. They are not getting to the root cause. So a lot of these medications that they prescribe are, nausea medications. Sometimes they're fluid pills to be able to help drain and release fluid. But again, these are just masking the symptoms. They're not actually getting to the root cause. So because of that, I'm going to put medications in D tier. Again, we're looking at long-term, not short-term. I always make a joke in the clinic when someone comes in here. Let's say they have like neuropathy, or they have vertigo or dizziness, or they have, migraines. I say there's a lot of things that are much better at getting you out of pain faster than I am, right? Painkillers, marijuana, alcohol. For me, my whole goal is to look long term. So because of that, I'm putting medications in D tier. Last one, dizziness diary. So this is key. A dizziness diary or having some form of journal of when you're having episodes is going to help the provider pinpoint, especially if you have a good one. It's going to help them pinpoint exactly what's causing or what could be triggering, not necessarily causing, but what could be triggering your dizziness. And this can help sort of peel it back towards the cause. It's a lot longer of a process, but, if you were to do it long term, you'd be able to see exactly not just what triggers it, but based off of those triggers, what actually gets us back to the root cause. So because of this, again, it's free because you can do it. It's free. You can do it anywhere, anytime. It's beneficial long term. The problem is patient compliance, and so because of that, I'm going to put it in B tier because type A patients that I take care of, they will do this no problem whatsoever. But for those other types of patients who are you're just not going to get them to write in a journal and to document their process. So because of that, strictly off of patient compliance long term, I'm going to put that in B tier. So that's all I have today. Tell me what you think. Tell me what you've tried in the comments. Tell me exactly, what has worked for you, what hasn't worked for you. And I'd be interested to know, right? I mean, I'm still on this journey. I don't know it all, but I know a lot, especially as it revolves around chronic conditions, but doesn't mean that this list is a comprehensive list of things that have worked. So go ahead and let me know in the comments exactly what has helped you. If you've liked this video, or if you know someone that's suffering from vertigo and dizziness, please send them this video. You never know if it's this video that may get them the relief that they need long term. Again, this is my tier list. This is strictly off of what I've seen work long term. So with that being said, I'm Dr. Cameron Daniels. I pray that you found this video helpful, and I will see you on the next one.